Okay. Good morning, everyone. Still got some others coming in. That's great. I'm Ron Venturella. I'm the procurement manager for Buncombe County, and this morning we're having a pre-proposal meeting for the request for proposals for the opioid recovery housing advisor contract. With me this morning from Buncombe County is Victoria, who's behavioral health manager. Is that correct,
Yeah.
Victoria?
Yeah.
And Kathleen, you're in strategy and innovation. Is that correct? What's your position title?
The behavioral health and justice analyst.
Okay. Okay. What? Let me close this transcript there. It's drawing my attention away from what I was wanting to discuss. So what I'll just go over some housekeeping things, some procurement items this morning, and then I'll turn it over to Victoria and Kathleen and let them talk about the scope of work and whatever else they have planned to discuss. And then I guess, would y'all like to open it up for questions at that time? Okay.
Yeah.
Okay, so I'm just going to talk about the schedule of the RFP for a few minutes. So first of all, we have this meeting this morning. It is not mandatory. So any organization or individuals that do not attend, they can still submit proposals. But of course, hopefully by you attending, you'll be able to create and submit better proposals than someone that does not attend. So we do have a time frame or deadline for questions. And so the deadline for questions is the 5th by 5 p.m. So, and you would be emailing any questions after today to me, and then I'll condense or gather all those questions, and then we'll respond to all those questions in the form of an addendum by the 9th. Or on the 9th or earlier, depending on how many questions we have and how long it takes us to create the response. And then the deadline for your proposals or submittals will be December 20th at 3 p.m. And we'll be accepting those electronically by email, and those you would email those to me. If you have any and normally what I do is once I receive those emails, I'll open them up, be sure I can open up those submittals and can read them, and then I'll reply with an email. My phone number is in the RFP, so you are welcome to call me to be sure. You know, if I don't have time to respond immediately, you can call and ask if I've received your proposal. And then we hope to be able to follow the last part of the schedule there about being able to review an award and then have a contract created. Let's see if I have anything else I want to discuss this morning. I think that's it for me. Victoria, Kathleen, is there anything else that either of you would like for me to discuss or hit on?
One thing that I would like to maybe just hear is, what would an individual need to keep in mind if they were going to contract with the county? Any documents that is really required or preferred? That would be helpful. Just
and I think along that line would be insurance. So there is insurance listed in the RFP of what we normally require from organizations. Now, that doesn't, not every organization fits into that niche. So, if you're just one person, you're not going to have workers' comp. So those are things that we can review as we're negotiating the contract. So just keep that in mind. And that's really it of what we would require along, with signing and agreeing to the contract that we would require and for this contract.
Okay, perfect. Thank you. I know that sometimes might be a question is, do I qualify?
Right. So hopefully we've already taken care of that question.
Perfect. Awesome. Yeah, and again, like today we're hoping to share a little bit, obviously we have written out, but just to further just kind of share what we're thinking of, and what we're hoping to maybe see, and also just to get questions, and maybe any, concerns as you're looking at this request for proposal, that maybe kind of like makes you pause, so that we can even kind of learn how are folks responding to this? Is this feasible? What are those thoughts? So again, if there's any questions or things that make you go pause, please feel free to ask those questions. And I think the key thing is, as Kathleen and I have been reaching out to the community, talking to different groups and folks, we know that housing is important. I know one of our medical staff with MAHEC said that they wish they could just write a prescription, to get someone into housing, because we know that it's that important for someone to maintain, engage in treatment, and to have a safe housing, safe shelter to live in. And we are fortunate that we do have, there's lots of options, but we also want to look at how can we make this equitable? Are we meeting the needs of those that are seeking out those services? Are there potential gaps for those that might be seeking that treatment? We want to also make sure that we're getting positive outcomes, seeing that people are able to maintain their recovery, get connected to the right services, whatever that they need, as best as possible to maintain that progress. And so again, wanting someone who ideally is familiar with Western North Carolina. It's not necessary, but that's, just really understanding the landscape, the history, and being able to really look at what do we have, what does it look like, what types of levels of care do we have, what are those barriers of getting into recovery housing. There's times that people might need something special, or they are on medications for opioid use disorder. Is there enough space? Is there enough availability? Being able to then provide recommendations on how we can use these opioid dollar funds. We know that what we're hearing is that just creating more opportunity to pay for someone's maybe cost to stay in housing may not always be what's needed. I'm sure that's going to be a piece that will help. But what creates even maybe sustainability, that long-term, financial support, so that we are able to have more people getting into affordable housing in the community. And so I think, looking at what you are thinking of, how you might go about doing this, who might you contact, what are some tools that you might use to kind of put these things together? What are some examples of potential research? So what are some best practices that you're familiar with, that you think that you would pull from? Again, just for us to get a sense of where are we leaning towards, how much does this individual know to be able to follow through with the project. I'm trying to think of what else. And I think it's being able to talk to people. We are doing some surveys, and so I did have in here about meeting with Kathleen or I bi-weekly, and that was just to really know that you have partners in this, that we can help share information that we're learning, that we can help make contacts if need be, that we can also kind of keep informed about how this is moving forward. Because of the timeline, we're wanting to make some recommendations to the commissioners in the beginning of the year. And so I think being able to kind of know along the way where things heading towards, what are we seeing is potentially needed, can just kind of help us be informed and be prepared to be able to have those funds available. So again, not to make it more work, and obviously we can be flexible if there's, not much has happened in the first 2 weeks. But again, the intention is to just have close connections and to collaborate on this process. And so I am curious, maybe as people give some questions, or if Kathleen, is there anything that stands out to you that you think would be important to highlight? And then we can see what questions we might have.
I think all I would say, to just sort of reiterate your key points, is that I think it's accurate to say that we are hoping that this RFP and putting funds behind somebody's ability to spend time doing this work will produce essentially, in short, a current state analysis of what is true about recovery housing resources in Montgomery County today, as well as a set of recommendations for how, if opioid settlement funds were to be allocated for recovery housing resources, what would be the most strategic and effective way to use those funds based on needs identified in that current state research conducted. So it's both where are we today and what would be effective ways to enhance those resources based on needs identified in the current state.
Thank you. So yeah, any questions or that come to mind for folks?
How would you like to open those up, Victoria? Would you like for people to raise their hand or type into the chat?
Raising the hand would be good. And if you're not familiar with raising the hand, even just kind of coming off mute, we can kind of draw attention. Because I know sometimes finding that hand. But Amy, I see your hand.
Hey y'all, thanks. So I heard y'all say a couple times individual, and I know this is a contract to hire a consultant, but in terms of agencies locally that might be able to onboard the consultant, I'm assuming they could apply, right, on behalf of whoever they would onboard as a consultant. Is that accurate to say?
I don't have anything that would say no. Ron, would you, if it was an organization that applied and then they hired someone internally or within their organization to do it?
Yeah, and I guess, and you may also be referring to what we would consider a sub would be, I guess, if they're not an employee of your organization. So yeah, I could not see any why we couldn't allow that. So
okay,
you just need be sure you point that out in your proposal.
Okay.
If they're not an employee, like if they were.
Just so that we would know that when we would start creating the contract, if it's awarded to your organization, how we need to word the contract.
Okay, so that would be for not an employee, but if we hired our own employee, then that would be different. Okay.
Yeah.
So then my only other question is with that, I know that this is supposed to be a short contract, but I can imagine for anybody other than maybe a single person applying for themselves that it would take a lot longer to kind of not only onboard somebody, but also do the planning, right? The research and like you said, choose the research methods and then actually getting out there and doing the work. So what's the flexibility in the timeline of this and also the amount?
Yeah, I mean, we have some flexibility. Again, was hoping to be able to have some guidance to be able to potentially operationalize funds for fiscal year 24 to 26. But there really isn't, there isn't something that we're like, it just has to be. And so I'm open, to proposals that are kind of saying this is what we think might be the best way to do this, and looking at that time frame. And even, the cost we do have, the 15,000 is what we had initially budgeted. We potentially do have some wiggle room with what we already had approved for this fiscal year. But I wouldn't say, I could say maybe another 5,000, maybe 10, depending like on what that time and the depth of work. But yeah, and that's where, again, I'm interested. That's where we even kind of like a budget or what would be the cost, because, I am curious of like, what would it maybe entail of doing research that you think might need to be paid for to get, sometimes you find a really good article and then you find out you have to pay for it, or, software to be able to kind of really enter in information and to be able to report out those things. So that was kind of the intention of what the cost is, or just even getting a sense of how many hours and what would that hourly cost look like. I think when we were kind of scoping it out, we were, and Kathleen, correct me if I'm wrong, because it's been a while, but I think we were thinking about $30 an hour, 20 hours a week for about a 3-month period. That's again how we just
Gotcha.
kind of came up with a number to get things going.
Gotcha.
And Victoria, let me ask you, be sure. So this is these original funds are from the opioid settlement, and so those funds are available year after year. They're not. It's not a use it or lose it within a fiscal year, correct?
Yeah, we do.
Okay.
We would have to report on any funds spent after the fiscal year. So within 90 days after the fiscal year, we'd have to report to the state. So if it was a project, we're still in the works on it, that would be a piece we would still need to be able to provide an update.
So the funds are being held at the state, or we got okay.
We have the funds, but then every year we have to report to the state. What did you use it for? What's the progress? What's the general outcomes? We are fortunate because we have less than 3% of the funds. Only our highest amount the strategy we had the highest dollar amount attached to, we have to do a more lengthy report. Other strategies, it's a shorter report. So that's where I think, again, that's what's great with the opioid settlement. We have a little bit of flexibility if it goes past June 30th. But again, we're hoping to, even if it was, we have a preliminary, here's one phase that we could work on. We're needing to do additional work for that next phase to really make a longer term, plan. And Amy, this, right? Like it's one of those, we want to do it well, but we also know something needs to happen sooner than later. So we don't want to wait too long, but also want to do it well.
Yeah, thanks.
Any other questions or thoughts? Paul.
Hello, I'm Paul Moon with Land and Sky Regional Council. I've been working kind of in the background on this issue. I work on some housing things. I'm curious to know what role other funding would play in, or identifying other funding opportunities would play in this RFP. Specifically, the commerce program that we met about a long time ago. I have been pestering them to find out where to get a final. I'm glad to check in with you to share the update from them is that there is no update. But with that being a potential significant funding source for recovery housing, what role identifying other funding opportunities would play in this RFP?
That's a great question, Paul. And I think, what we've been saying and thinking of is let's dream big. What do we want our community to look like? And I know even with the Land of Sky Health Forum and with Dogwood there was definitely that kind of let's dream big. What do we want? Because even if the opioid settlement can't do it all, there may be other opportunities and funding. So I guess I'm not maybe necessary. I could see someone being able to be man, this was what would be really needed. Right, it will cost several $1 million to really implement this, but maybe that then here's some incremental steps that we're able to maybe take and be looking for additional funding. So I think that's a good point, right? We don't want to be narrowed down by just what the opioid dollars are, because there could be other grants or other funding sources that may support those efforts. And as you said, I think even the state, they're probably going to have some more grants coming available from the opioid settlement that will be made available to local governments or private entities. So I think looking big and considering what other, if we had other fundings, what would that look like? What could we do with that?
Thanks.
Awesome. Thank you. Kathleen.
Thanks. I just wanted to hop in and say, Paul, I think that sounds like a great example of the type of recommendations we might be looking for from this position. So a recommendation would be, here's 6 other funding sources on this topic. Braid this percentage of the opioid settlement fund. If you were able to braid this percentage of the opioid settlement funds with source A, B, and C, here's what you could create. Here's what we could do with that. So that to me falls under that scope of, I mean, it's a broad request for somebody to make recommendations, but that sounds like precisely the type of insight we're hoping this position will bring to our planning table.
Would identifying, success stories in other places also be a part of this? Or is that something that we would be doing anyway?
I mean, we hadn't necessarily defined it, but I think that would be something that would be helpful, to hear and what someone would recommend. And again, that's something that Kathleen and I are willing to kind of work with that person, because we're constantly hearing about new programs or opportunities, and we're wanting to outreach and just learn more, so that we can keep those, what are those options, right, in mind. And so then, even if as our steering committee, we're like, here's some elements we really want, then we can be like, oh, this one and this one had these elements as well. And how can we model, how did they go about that? So I think that's great questions, Paul. I love that. Great. Any others? And don't forget, you can continue to send Ron questions.
Absolutely. Yeah. By December 5th, be sure, I'd recommend reviewing the RFP again, and then firing off any additional questions you may have for us. And then we will reply to all of them in the form of addendum. And then that addendum will be sent out to everybody that attended today or has posed questions, and then will also be posted on the procurement page of Buncombe County.
Hey, Kathleen. Hey, Victoria. Hey, Ron.
Hi, Stuart.
I'm curious what you see as the nature of the partnership and the biweekly conversations that would be happening. I imagine that there's this a set of skills and knowledge that you all have, and would just like to understand more about how we would be collaborating as I think about our proposal.
Yeah, and again, the intention was to, one, to know that there's a partner in this, just because we have been talking with folks, or there's been conversations. We want to just, to be a resource to say, oh, and here's someone else, or we're already meeting with so-and-so, jump in with us, or just kind of keeping informed of maybe how that progress is going. Again, like kind of thinking of the timeline of just keeping, hey, where are we leaning towards, or what's coming up, or what are those challenges, or what's information that, again, Kathleen and I might be able to do. So this is our full-time, job. I mean, there's a lot more, work that we're doing. And so again, and we're not experts in recovery housing, and to really dive into that. And so and even when I said biweekly meetings, it might be as we're contracting or looking at proposals, it might look a little differently. But again, I wanted to at least kind of express, we want to kind of keep informed and not just wait till the end at 3 months and then find out, but just kind of work together to make it the best possible, sharing resources and looking into things if need be, just so that we can, again, get, figure out what are those hurdles and how can we work through those, and just, again, be partners on it. Not that
Great.
the person who's doing it would be doing it and guiding it, but that we would just kind of be like, oh yeah, let's give you that support. Here's a resource, or those kind of things. Not like doing for or telling maybe like what you need to do. You got to do it like this. But again, just kind of being collaborators.
Great, yeah, that's helpful.
Sorry, I would just add, and bringing in, as Victoria said, you know, we're not recovery housing experts. That's why we'd be bringing this person on board. But the perspective we could bring is information from the opioid settlement strategic planning process. What are we hearing from community? What are gaps in our own research that we've gathered, and bringing that information to the individual, the advisor, whoever is awarded the RFP, to say, here's what we know, here's what we're hearing, let's work together to identify those gaps and have that guide research focus, in addition to whatever focus the person's expertise would already have as direction for the work.
Great, thanks. I have one more question for y'all. I'm curious what thoughts you've given to like quantitative analysis, and what data availability exists, like what data sets you might have available for locally.
Yeah, I think and it might take me a minute to find it. I did find kind of in preliminary, kind of just looking myself, there was a project that was done. Oh, and you can't find it right when you need it, but I want to say it was Start. I'll have to look for a minute and maybe can send it, but there was a national kind of study looking at recovery housing, and they used NAR, the National Association of Recovery Residences, as like the helping identify what level of housing they were, what were the locations of the housing. So they did map out for each state. And this was actually done pretty recently. It was like in 2020, 2021. I want to say maybe it came out in 21. And so I feel like there was some good, global view of what kind of the nationally, what does recovery housing look like? And again, they broke it down into North Carolina, and even just looking at that our surrounding counties don't have recovery houses. I think Transylvania maybe had one. And again, at the time, Orange County was probably the largest county with recovery housing. And so they also talked about like I think it was like per capita, like what's the availability per capita, but also looked at, I think, like the risks of overdose within like those communities or those counties. So again, it was kind of like big view, and I could see that being an area where then we're able to kind of dive in really specifically to Buncombe County. But again, the National Association for Recovery Residences has been something that really sets like what standards are and levels of housing and what those look like. And that is within lots of different states. Even North Carolina has their association, the North Carolina Association for Recovery Residences. And so I think that could be a resource to kind of use and to model what's that information that we might be looking at and gathering. But I also left the request for proposal open, because I was like, oh, I could say more detailed, but then, there might be a whole brand new idea or a different view to look at that. But I'm gonna pull up that research article and I'll drop it in the chat once I put my hand on it.
Thank you. Helpful.
While Victoria is looking for that article, are there any more questions for us today?
It was the National Study of Treatment and Addiction Recovery Residences. And once you kind of dive into there, you can find a little bit more about the local information. Any last questions?
I guess everybody's opening the article.
But it's not even like it's like the project, and then I think within there it'll show more. But I'm glad Stuart asked about it.
Yeah. Good questions this morning.
Yeah. And it also kind of references like the SAMHSA's recovery housing best practices and guidelines. All right, well, we look forward for any other questions that come up to be able to answer those, and then look forward to seeing what proposals we may have, and working with whoever is able. Feels like it's a promising plan, and so we appreciate you all hopping on and joining us today and asking questions.
Thank you, everyone. Look forward to hearing from you with your questions and seeing your proposals.
Thank you.
Thanks all.